Hi, I'm Kim Hanton, and I'm a member of the Revere Board of Health. And recently, we issued an advisory regarding the increase in opioid-related overdoses. Gary Langis is here with us. And Gary, what do you attribute the increase in overdoses recently?
Well, I think the northeast region of the United States has always been historically really hot spot for opioid use, rather than in other parts of the country. It's not as prevalent as it is on the East Coast. And over the years, we've always had folks overdosing, but now it's the population of drug users, for one reason or another, maybe some getting introduced to heroin through prescription drug
We've
use.
also heard about this laced heroin with fentanyl. Talk a little bit about that.
Yeah, the fentanyl it's like about 80 times stronger than heroin, and a lot of drug dealers and people that are selling drugs now are cutting their heroin with fentanyl to make it stronger. And you know, any heroin you get on the street, it's not USP heroin. It's not like government controlled. So it's all different qualities of heroin. And some of the fentanyl medications being put in, it's black market fentanyl that probably is coming down from north up in Canada, being made at labs, and it's starting to hit around the country. There was a big spike in Pittsburgh and in Rhode Island, and now we're starting to see a little bit of it in Massachusetts.
Do you think the celebrity piece is allowing this to become much more of a public awareness piece?
Yeah, like we had the death of Philip Seymour Hoffman,
Recently,
and so you hear about it.
Mm-hmm.
Before that, it was Corey Monteith.
That's correct.
That overdosed. You hear about it, and then it dies down. You don't hear about it. But
that doesn't mean we don't have people overdosing
right,
every day.
Because the same day that Philip Seymour Hoffman died, 100 people died in this country from overdose. The same thing. Mm-hmm. So it's happening, but you hear about it more when it's a celebrity or like some kind of an official or something like that. But it's always happening. In 2010, there were close to 40,000 deaths attributed to opioid drug use.
I know data also indicates right now that the opioid overdose, this data is suggesting that the prescription opioids are much more prevalent in the overdoses than heroin today. Is that accurate? Is that statewide information?
I think
national?
we've seen an increase in the prescription overdoses. I mean, nationally, it's in the same year, 2010, out of those close to 40,000 folks that overdosed and died, 60% of them were from pharmaceuticals. So that was in 2010. Now we move up to 2014, and a lot of those people that were using medications or prescription drugs, they've switched to heroin. Why have they switched to heroin? Because maybe we've done a really great job in closing the pill mills down in Florida. Mm-hmm. We've put restrictions. We have prescription monitoring programs. So doctors are more accountable for the prescriptions they write, mm-hmm. and so they become harder to get on the street.
And we're educating the doctors.
And we're trying to
becoming
educate
partners.
Docs now. Yeah, that's right. Doctors
collaboration.
are like sitting at the table with us now to address some of those mm-hmm. overprescribing, med-seeking folks that come into their office.
So they're also educating the people that they treat. The primary cares, have more information, and they're able to give that off to their consumer.
That's correct, yeah. And there's a lot more information out there. And I see a lot of the doctors seeing that connection with, like, people becoming introduced to stronger drugs through prescribing practices. So I think they're really jumping on board really fast, especially in Massachusetts right now.
Well, I know in Revere we've worked really hard, to combat the fatal overdoses. Correct. And I know the numbers right now to date indicate from January until today, or probably most recently, there were 44 documented overdoses just in this city alone. And there was a 2-week period of time where, well, it wasn't even a 2-week, it was a
6-day
period of time where there was 16 overdoses, 2 of which were fatal.
Correct.
So we have to get that message back out there again, that we can, help support, reversal, opioid reversal. Overdose doesn't have to be fatal. We can work together as a team, and we do. Like every Tuesday night, we offer enrollment and training in opioid overdose reversal at 265 Beach Street, North Suffolk Mental Health Revere Counseling Center, where Gary and I are both present there. What we can do is we can offer this training. We have a training that we had recorded probably about a year ago, and we'll take an opportunity right now to take a look at that training, and then we'll come back and provide you with more information.
So what we're going to talk about now is some signs and how you recognize an overdose. And then what I'm going to actually do with the help of Gary is role play, steps taken if I believe somebody's in an overdose. So as I come up on somebody, like I said earlier, an opiate overdose is respiration. So what I really want to focus on is everything around respiration. How is he breathing? Is he breathing? Is he not breathing? But also then the outcomes of not breathing, which typically as I come up on somebody, it's going to be looking for lips and fingertips. Those are the first signs of the body where it's going to be turning blue. And when I see blue lips and fingertips, I know I have a real problem. So, Gary, you okay, man? So what I want to do is be verbal. Folks under an opiate influence, folks that are high can hear you. I want to first be verbal with anybody. Man, are you okay? Gary. With no response, I'm going to say, I'm going to touch you. I'm going to just give him a touch to see if I can wake him lightly. He's not waking up. What I'm going to want to do then is to give his body enough stimulation to wake him up if he could wake up. Typically what folks do for stimulation is punch, slap. What I'm going to do is hopefully less damage and minimize outcomes for Gary, but hopefully cause enough pain to wake him if he's going to. I'm going to bring my knuckles up and I'm going to deliver a sternum rub, like so. I go right to the sternum with my knuckles and I rub very hard. Gary, wake up, wake up. Gary's not waking up, then I'm going to bring my knuckles once again to the top of his lips, right above his gum line, and I'm going to rub. Gary! Gary's not waking up. What I need to do now, and I see he's not breathing, and I can see some discoloration on his lips turning blue, I need to get 911. Call 911. What I'm going to do now is get Gary down on the ground and deliver rescue breathing and deliver Narcan. All right, so what I need to do now is make sure Gary's head is tilted back. I'm going to deliver rescue breathing. Remember, we're not talking CPR. At this point, Gary's heart has not stopped, and if I do chest compressions, I could do some damage to Gary. So I'm going to deliver rescue breathing. What that involves, I'm going to put a barrier that's included in the Narcan kit. I'm going to place it over Gary's mouth. I'm going to deliver 2 breaths of air. I want to make sure his lungs come up, go down, come up, go down. I'm going to wait 3 to 5 seconds and deliver another breath. There. I delivered air into Gary, and what I need to do now is to deliver the Narcan. Each kit comes with 1 dose. It's important, like I said earlier, to have a plan of action. Know where the kit is. Time is important at this point. This is 1 dose of Narcan. I'm going to finish the dose up the other nostril. And when this is empty, that is 1 dose delivered. I'm going to sit back and wait. If Gary was blue, I would continue rescue breathing. Typically, Narcan will take effect 3 to 5 minutes for Gary to wake up. If after 3 minutes to 5 minutes he's not responding, I'm going to go to the 2nd dose.
Cool. We can do a little transition.
Cool.
And then
Do you want to wake up some?
I wake up.
okay, so and back after.
Gary, you just overdosed, dude. You just overdosed, man. I gave you Narcan.
Oh.
You're okay, dude. I'm going to stay with you, man. 911 is on the way. I called them, okay? You're gonna be all right, man.
Oh.
You almost overdosed, dude. You almost died.
No. No, I'm all right. What are you doing here?
Man, you almost overdosed. I just came up on you, dude. It's all right, dude. It's all right.
So Gary, in that training, can you talk a little bit more about what we'll see now, with the fentanyl laced? Is it similar? What kind of symptoms and
Yeah, and with the
signs?
fentanyl, again, it's like it's 80 times stronger sometimes than heroin. So you're going to see the same signs, but it's going to be happen faster. Like a regular heroin overdose, it takes anywhere from an hour to 3 hours to die. With a fentanyl overdose, you could probably die within a half an hour. So it's really important to know the signs and the symptoms of an overdose. And the signs and the symptoms of an overdose are like, people that are nodding. You see people nodding out from an opioid drug, and they look tired. Their eyes are closed. They're maybe scratching. A slurry voice. Then when the oxygen starts to be deprived from them, from the opioid laying on the brain receptors, you may see tints of blue form under their eyes. Their skin will get clammy and grayish looking. Their fingertips may look a little bluish. So those are the signs. And the best thing to do is call 911, and get an ambulance at least on the way.
But also, that being said, the ambulance on the way, the City of Revere,
That's right.
we're the very first fire department in the nation that actually carry Narcan
Right.
on all our fire apparatuses. We actually got visited by Washington.
We got visited by the Office of National Drug Policy Director Gil Gerlikowski this past week.
Tuesday.
Was it Tuesday? Yeah, and just to recognize the efforts of Revere Fire Department for being the first in the country to carry naloxone or Narcan on all of their fire units, and they've reversed quite a few overdoses, over 100 since the program started in February of 2010.
And it came on the heels of the Mass Call 2,
Correct.
which was an opioid prevention grant that the City of Revere had rolled out, and they partnered with many of the stakeholders in the community, and we feel like it was a successful rollout, so much so that we were able to go for another grant, a MOPSI grant, where we were the host community within the region. And
Right.
what are the
In 2013, Revere received the continuation grant of the Mass Call 2, the MOAPC, MOPSI, and that was to work in a more regional effort around overdose prevention. So we work with 3 other communities. We work with Winthrop and Chelsea and Saugus.
Correct.
To duplicate some of the strategies we've implemented in Revere. Like
and
you
also
said,
to enhance, because there's another layer to this grant. It's not just preventing the fatal.
It's preventing opioid use. It's
education.
Education
And treatments attached to
and
this.
Treatment. But like duplicating some of the strategies. You go back to Revere being the first fire department. Why did that happen? Because there was personnel in the fire department that saw a need for this. They heard about the pilot program that was in Massachusetts, and they made the effort and to get it on their department. And they had to go through a lot of barriers. I mean, you have to go through unions, and you have to go through waivers, and you have to do this and that. But we found a way to do it through collaboration with the Mass Call 2 Coalition and the Fire Department and the Massachusetts Department of Public Health.
Absolutely.
To where we could, really get it formed. And now that effort is expanded into Saugus. Saugus Fire Department carries Narcan.
That's correct, yeah.
It's going to, if they're not doing it already, Winthrop is trying to carry
And I know Chelsea's
Narcan.
really working
and
really hard at
Chelsea's
that
working on
as
it.
well.
So that's
Absolutely.
the regional approach, and the way the grants were awarded to the host communities to work more collaboratively with their surrounding communities. These efforts are like surrounding Revere right now, and then it picks up in Lynn, and Lynn works with Peabody and Salem. So if they do the same efforts there, it makes it wider range. You're touching more people, you're educating more people, you're preventing more overdoses. And after Salem, the host community of Gloucester has Beverly and Danvers and Gloucester. So that's the whole North Shore that's being covered, and I think it's a really successful way to approach the overdose crisis that we want to right now. And again, like addressing the overdose crisis, it also engages people that are using the drugs to where you engage with them, and when that person needs services, when they need detox services,
So basically,
maintenance
when they're
programs.
ready, when they're
Exactly,
ready, we're
when they're
meeting
ready.
them at their time.
That's right, and we can, you know, link them with the services they need. If it's like, you know, medication substitution for heroin, if it's, you know, detoxification, things like that, we can get them into treatment, outpatient treatment. You know, like that's the way it works, and it's really good to see it going more regionally. And Massachusetts
absolutely.
is a model. Like we are a model, and that's what the director of the Office of National Drug Policy was saying, that we're a model for around the
Absolutely.
country, because other
Absolutely.
countries, like, I mean, I had a call from Austin, Texas this morning, like, you know, like, we want to do this, you know, like, we want the police to carry this, we want the,
And we want you guys to show us how,
Yeah,
because
you know,
you've
because
ran the
we've,
way.
you
Now,
know,
we've seen the numbers increasing in the identified overdoses, and the data all, you know, throughout the
Right.
state, you know, is really striking.
Mm-hmm.
But do you think, you know, I know I have my theory on it as well. You know, we've been doing this a long time, both you and I,
Mm-hmm.
you know, and I think that we talk about destigmatizing, you know, and really becoming more welcoming at certain tables, and we certainly have manned that, and we get invited, you know, to a variety of different places to speak and to really have a message that's being heard. And how blessed are we to be living in this era that that's the case.
I think we're really coming up with solutions today. We're really coming up with solutions, and like, we know that it can't just be singing to the choir. It's you need all people sitting at the table. You need treatment folks. You need medical providers. You need treatment providers. You need law enforcement.
You need your
people
advisory
working
too to
in,
be made up
in,
of the users.
Exactly.
You know,
You need your harm reduction
Absolutely.
aspect of it, and to get the message, you know, that, you know, we're working together on this, you know, and it's not that, you know, a drug user is any different than us, because they are entitled to life, liberty, and the pursuit of happiness like everybody else. They're just struggling with a substance use disorder that they need help with, and I think we're doing that. We're doing a really good job at it.
And do you think the numbers reflect that somewhat?
I think the numbers reflect that. I think the language that's being used, instead of calling people by the name, you know, junkie or you know, things like that, they're people from the drug using community. They're persons with substance use disorders.
Needing
And
help.
I think that's, you know, like, that's what happens at these committees and tables. Like, the language, we start to first compromise on the language we use, and then the strategies we use to reach that
And I
population.
think families are becoming a little bit more confident and comfortable in speaking out, and some of the, you know, guilt and shame, though it's still present and though we have a long way to go, I do think that the support that they've been given by these communities is helping them have a voice,
Right.
which is the most vital voice in all of this.
I think so, and you know, you can see it in like over the last 10 years, like, you know, we have them down at Revere Beach. We have the memorial down at Revere Beach to remember these our family members, our loved ones that have passed away from drug use. And we see that happen in a lot of communities. You know, up on the North Shore, Lynn and Gloucester, and you know, all of these communities that, you know what, I know. In the past, it's been very shameful. People don't want to admit that, you know, we take it on ourselves, like, oh, I must be a bad parent because my child is
Absolutely,
using
you hear it
drugs.
all the time.
You know, and it's like, am I a bad parent because my child has another kind of disorder? No, I do the best I can.
It's a painful journey to
It is.
accept and to travel.
It is.
You know, and we have to make it a little bit easier and provide the support that's necessary in order
And the
to do so.
compassion,
Absolutely.
you know, compassion for folks, and I don't know who the next person drug user that we train in Narcan is going to, like, you know what, maybe go on and shine in his life. And, like, you know, we've seen it happen. There's people
Absolutely.
in political office now, like, you know, we just elected a mayor in Boston that is in recovery. Okay,
certainly is.
we have people on national level that are in recovery that have stopped using drugs. That's wonderful and everything, but
And
some
they're
folks are
changing
going to.
policy for
That's right,
us.
and they're helping us with this policy stuff. That's a voice that we haven't had in the past, and I understand some folks are never ever going to stop using drugs, and we're going to lose people. but we can reduce the numbers. I'm sure we can reduce the numbers, especially through the training we do at the drop-in center on Tuesday nights from 5 to 8. It's, you know what, if you have a child, a loved one living in your house, you engage in any way with an opioid user,
You should come
any
and
way,
get trained.
you should have one of these kits in your medicine cabinet.
Absolutely.
You know, if you have a child,
And you can.
and you can. It's free. This training is free. You don't need insurance. You just come into the office on Tuesday nights. We take care of it. It's like if you had a child that was allergic to bee stings. I'm sure you have an EpiPen. If you have a child or a loved one that's battling with substance use and opioid use in particular, you need one of these in your medicine cabinet. I mean, it's such an easy training. This is a medicine right here. You know, and you see this on the video that we showed earlier, but it's just so simple. It's like bang, bang, boom. Put it together. You spray it up, half up each side of the nostril.
And save a life.
And in
save
1 to
a
3
life.
minutes, a person that has been blue, dying on the floor, is awake. And you have time. You have 30 to 90 minutes to get them medical care that they need, especially if it's fentanyl they have injected or used, because they're going to go back into that overdose. So you want to get them medical care. You know, they're going to look like they're all well and better, but this wears off in 30 to 90 minutes, and a fentanyl can last in your system for up to 8 hours or longer, and so that overdose can come back. So you want to get them the medical treatment they need.
And I think it's important. We also welcome businesses. You know, we welcome anybody that may have any kind of connection to any opioid user. It's important that you have access to Narcan. And as Gary and I both have been saying, it's available. Narcan is available in the City of Revere every Tuesday night at 265 Beach Street. Please come. Please come and get trained. Please come and get your Narcan. Thank you.